And so I asked the group, well, where should we publish this? And PLOS Med was it. There was no question. That's where the group wanted to go. And those who were advocating that even went through the impact factors for the various journals and said, clearly, this is where we need to try to publish this work. And so we were very pleased that PLOS Med agreed to publish this as a collection. And it's with great pleasure then that I introduce to you the senior magazine editor for PLOS Med, Jocalyn Clark.
Thank you. Well, that is one of the better introductions I've ever had. As an editor, one of the defining features of an editor is that he or she must have a very thick skin. So to hear such praise is very gratifying, and I sincerely appreciate you providing that backstory for me. So as Jennifer said, I'm Jocalyn Clark. I am a senior editor at PLOS Medicine, which is the flagship weekly medical journal published by PLOS, the Public Library of Science. PLOS Medicine is also the world's leading open access medical journal. So delighted to be here. I'm delighted to see so many of you here to help me and us celebrate and launch this PLOS collection. The issue around measurement of intervention coverage is a critical issue for global health, as Miriam and Elizabeth have outlined. It's also for us as general medical editors a critically important issue for our readership. This collection comprises, I'm very proud to say, an outstanding set of review and research articles. Some of them are published in PLOS Medicine, and others are published in PLOS One, which is our sibling journal, also published by the Public Library of Science. Both of these journals offer open access publication, and this then permits wide dissemination and sharing because there's no cost or other access barriers to people using these articles now or ever. So what you have in front of you is a very nice print collection of the articles all together for your use. But online, all the articles have now gone live as of this morning, and they're available for you without barriers to use. As Jennifer mentioned, the collection was pitched to us by CHURG and their sponsors, but actually all of these articles underwent a normal, rigorous process of peer review and editorial review. So I describe that process as normal and rigorous. The authors in the room and Jennifer, as the coordinating author, will probably describe it to you also as rather painful at times. And the fact is that there were a number of articles submitted to this collection that weren't accepted for publication. But nevertheless, the rigorous process meant that in many cases, several rounds of revision and review were done by the authors. And the review depended a great deal on the expert and incisive independent review by experts in the field. Some of them served as academic editors. Some of them served as reviewers. And their comments and feedback to the authors really helped clarify the message and strengthen the analyses that you see here today. This took a great deal of time, a great deal of effort on the part of the authors and the editors, but what resulted is a group of articles of the highest quality and integrity. I think we can regard these as the state of the art in analysis of measurement of intervention coverage. We can see them as the best of the best. As the authors say, we can do much better, but here we have a very fruitful baseline to continue that dialogue. For many people, particularly those who read the general medical or global health literature, these sort of measurement issues actually might be seen by many as a more specialist topic, possibly a topic that belongs in a more methodological journal, for example. But at PLOS, we really recognize that measurement issues, as we'll learn much more about in the remaining time this morning are the very foundation of our evidence base for global health. If we don't know how well we're measuring coverage of care, we don't know how we can do better, and how we know that proved interventions are getting to the women and children that are needed. So we recognize that this is at the very foundation of an evidence base that can guide policy and practice. I look forward to hearing from the authors and them sharing with the group their findings. And I just want to close with a final remark, and that is that I ask you and I encourage you to read the articles, download them, share them with your colleagues, blog about them, tweet about them. And in particular, for those who are social media savvy, we have a hashtag associated with the collection, and I can tell you that the only thing harder than coming up with a jazzy acronym for measuring coverage of maternal, neonatal, and child health was to come up with a jazzy hashtag. But Jennifer and her team have done so. It's CoverMNCH, so I encourage you to tweet away. All of the articles, as I said, are now live online at PLOS.org and PLOSmedicine.org, and they have the ability for you to, in real time, comment. So please do comment, give us your feedback, and we look forward to being part of the conversation.